The newly released 5-star ratings are posted on the Hospital Compare consumer website.
We knew that the CMS ratings were coming out. We knew that our scores were probably fairly high.
Sarasota Memorial Hospital is one of the few hospitals to receive the 5-star rating granted by CMS, the federal agency that oversees the Medicare and Medicaid programs. Many hospitals receive 3 stars, which is average, and others just 1 star.
That Medicare has gone out and rated every hospital in the United States.
There are more than 60 categories that the hospital's actually rated on by the Centers for Medicare and Medicaid Services, but it was complicated, so now they simplified it with a 5-star rating.
We have some of the lowest infection rates in the hospitals in the nation. We are always looking at ways to get those down. Perfect means we would have 0.
Sarasota Memorial Hospital's CEO David Verinder says the hospital strives to excel, citing patient satisfaction Medicare HCAP scores.
Every month I go into our public board meeting that's televised, and I present exactly where our HCAP scores are, the good, the bad, and the ugly.
This is the result of teams of people, says Verinder.
We're one of the leading hospitals in the region, and certainly much higher than the national average.
Consistently practicing high quality care, and the medical staff and the nursing staff, and kind of all of us on the team.
Chief Medical Officer Steve Taylor says the medical staff does much work on making sure SMH minimizes variation.
What do the research articles and the academic medical centers say is the best antibiotic for pneumonia, or the best surgical treatment for heart disease? And are we practicing in those kind of current evidence-based standards?
Verinder says the hospital couldn't be happier of the 5-star rating.
But you know what we're focused on today? We're focused on how do we make these scores better, so we can get our patients everything they need.
And the 4 factors given the most weight in the overall star rating are patient safety, the patient experience, the rates of unnecessary patient readmissions, and rates of unexpected patient deaths.